What is spinal decompression therapy and how does it actually work? In this video, I'm going to answer that question in a way that finally makes sense. I'm making this because I see so many people dealing with constant back and leg pain from that L4, L5, L5S1 disc herniation who feel just completely stuck. They've tried pain medication, cortisone, injections, physical therapy, exercise. Nothing has helped. And the pain, it just keeps coming back over and over again. At some point, they start to wonder, is this just how life is going to be from now on? If that sounds like you are definitely not alone. And more importantly, there's a reason this keeps happening. And most people, they're never told the truth. So here's what I'm going to do. I'm going to break it down for you right now. I'm going to let you know what non-surgical spinal decompression actually is and what is physically happening inside of your spine, who this is really designed for, and who decompression is not for, what kind of results that you can realistically expect, and why this approach can work when all other treatments have failed you. I'm going to deliver this in a simple question and answer format, so it's really easy to follow. And make sure you stay all the way to the very end because I'm going to share one of the most important questions that I get asked on a regular basis. How do we find a good spinal decompression doctor? By the end of this video, you will have a clear understanding of whether spinal decompression makes sense for your situation or not. Hi, my name is Dr. Chris Cameron. I'm a chiropractor right here in Lucan, Ontario. I help people with degenerative spinal conditions like back pain, neck pain, disc bulges, disc herniations, and sciatica. I help them to overcome pain and get back to doing the things that they love to do through safe, non-surgical corrective methods. On this channel, you'll find practical tips to help you manage back and neck pain, heal disc injuries, and build a stronger, healthier spine. Be sure to subscribe so you don't miss our weekly videos on how to strengthen your back, protect your spine, and live a more thorough, enjoyable life with less pain and more confidence. If you feel like you tried everything and nothing has actually fixed your L4, L5, or L5S1 disc herniation, there's a reason for that. You see, most treatments are designed to manage your pain, not change what is happening inside of your disc itself. If you feel like you've tried everything and nothing actually has fixed your L45, L5S1 disc herniation, well, there's a reason for that. You see, most treatments are designed simply to manage your pain, not change what's happening inside of the disc itself. Pain medication, it reduces inflammation. Cortisone injections, they calm down irritated nerves. Physical therapy improves movement and strength, but none of these directly reduce the internal pressure inside the injured discs. So even if you feel temporary relief, the disc is still bulging on the inside or it's still herniated. And it's still pressing on that nerve. And over time, that pressure builds back up to where it was and the symptoms, they return. This is why so many people feel stuck in a cycle of short-term relief, followed by the same pain that just keeps coming back over and over again. And that is where non-surgical spinal decompression is different. So let's start with the very first question. What is non-surgical spinal decompression? Non-surgical spinal decompression is a treatment designed to reduce pressure inside the injured disc, which is the main cause of the pain. In conditions like the L45, L5S1 disc herniations, this is not just a general traction. The goal is not simply just to stretch out your back. The goal here is to create a controlled change of pressure inside the disc itself so it can finally begin to heal and recover. This is done by using a computerized decompression table that gently stretches the spine in a precise cyclical pattern. The table we use is called the Hill DT Spinal Decompression Table. Take this step further, it has advanced sensors that constantly measure how the body is responding in real time. If your muscle starts to resist or fight, the system automatically reduces the force, keeping the treatment smooth and controlled. And that matters because it prevents muscle guarding, which is one of the biggest reasons traditional traction fails. Instead of your body tightening up, it can stay relaxed, allowing the decompression to actually do what it's supposed to do and work. At its core, this treatment is about creating the right conditions inside the disc so pressure is reduced at the source. And once that pressure starts to change, something important begins to happen, which brings us to our very next question. What is happening physically inside the spine during decompression? When spinal decompression is working properly, it's not just stretching your back, it's creating a very specific change inside the disc itself. As the spine is gently pulled, the space between the vertebrae, the spinal bones, it begins to increase. And this does something critical. It lowers the pressure inside the disc and can even create what's called negative pressure, also known as a vacuum effect. This pressure change, this decrease in pressure in the disc, allows the bulging or herniated disc to start to move in the right direction. Instead of pushing out onto a nerve, it begins to retract slightly, reducing that constant irritation. At the same time, this vacuum effect helps draw in fluid, oxygen, and nutrients. It draws it right back into the disc, which is critical because injured discs have poor circulation and limited ability to heal. So now you're not just taking pressure off the nerve, you're improving the environment that the disc needs to be able to recover. Who is decompression for and who is it not for? Spinal decompression is designed for a very specific type of patient. And this is where a lot of confusion starts to happen. It works best for disc-related problems, like an L4-5 or an L5-S1 disc herniation. Bulging discs, sciatica, degenerative disc disease, especially when pressure is inside the disc. This is a major part of the problem. There are typically people with ongoing back pain, leg pain, or nerve symptoms like tingling, numbness, or burning that have not fully resolved with other treatments. But it is not for everyone. If your pain is coming from severe arthritis, spinal instability, fractures, or non-disc structural issues, this may not be the right approach for you. There are also a few contraindications to using spinal decompression: pregnancy, cancer, spinal tumors, osteoporosis, prior spinal fusions, broken vertebrae, or spinal implants. This is when a proper evaluation is so crucial. You need to identify the true source of the problem, not just what the symptoms are. What results can you expect from spinal decompression? This is one of the most common questions I receive because expectations need to be realistic. Spinal decompression is not an instantaneous fix. It is a process. Most patients notice gradual improvement over a series of treatments, not after just one or two visits. What you can expect is a reduction in pain, especially nerve-related symptoms like sciatica. And there's also improved mobility and function. For some, this means sitting, standing, or walking longer. For others, it means finally getting consistent relief after months and years of flare-ups. Now, when we look at the research, about 71% of the patients in our office report significant pain reduction after completing a decompression program. And in our clinic, 78% of our lumbar disc patients report at least a 50% improvement at the end of the first 3 months. Using spinal decompression as part of our Back Strong protocol. Why does this work when other treatments don't? If you tried multiple types of treatment and nothing has lasted, this is usually one of the missing pieces. Most treatments focus on symptoms alone, not the root cause. The treatments, they might reduce inflammation, they might relax muscles, improve movement, but they do not change the pressure on the inside of the disc. Spinal decompression is great for this. It targets the mechanical cause by reducing the pressure in the disc of the L4-5, L5-S1, so that the nerve is no longer constantly irritated. And there's another key factor: repetition. Each session builds on the prior one, gradually improving the environment inside the disc over time, creating changes that you simply cannot get from occasional one-off treatments. Next question: how do you find a good provider for this? This part matters more than most people realize. The first thing to look for is proper assessment, history, physical exam, and when needed, imaging. You want someone who identifies if your pain is actually coming from a disc or something else, not someone who just puts you on a machine and away you go. Next, there should be a clear plan and path. You should understand what the problem is, why decompression is recommended for it, and what the treatment plan looks like. Experience matters, and the equipment matters as well. A system like the Hill DG table is a very different from basic traction tables. If you're in the Lucan, Ontario area, you can look us up. And if you're not from the local area, drop a comment down below and we'll help point you in the right direction. If you've been dealing with back pain and leg pain for a long time now, maybe from an L4-5, S5, S1 herniation, and nothing has worked for long-term results, it's not because your body can't heal. It's because the right conditions haven't been created yet. Spinal decompression is designed to change that, not by masking the pain, but by reducing pressure at the source. Now you understand how it works, who it's for, and what to expect. So the next step is simple: figure out if this is the right fit for your situation. And make sure you're working with someone who knows how to apply it properly. If this video helped you, let me know in the comments down below. And if you want to see how spinal decompression might fit into your lifestyle, look us up for our 8-step back strong protocol. And I created a video that you can go watch right up here.